Hello, this is Dr. Johnson. I'm your host. Welcome to the Gorgeous Glow Skin Show. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about what to do when you develop a rash on your face. So I had a couple of clients today that came in, and one had a rash that unfortunately she caused herself. So she thought she had bugs on her skin, and therefore she started picking at herself. And unfortunately, it's leaving a lot of open sores that need to heal. But not only is it affecting her face, but of course she's picking everywhere else. So that's a concern. I had another client who developed a rash, and as days progress, it is spreading all over, out of her control. She hasn't done anything. It just happened. And now it's affecting her face. Of course, some of the lesions that are resolving are leaving discoloration, but the new ones are concerning. And mainly because she doesn't know what's causing it. So I'm talking to you today about what to do when you're in that situation. When you start developing a rash, you don't know what it is. Of course, you've tried your home remedies. Of course, you've picked at the skin. So I have that with a lot of my patients. They try to do things at home. You can go to the store. A lot of things that are over the counter at what point were prescription items, and now they're not. And so sure enough, that's an option for you to try. But if that doesn't work, what do you do? Well, number one, you want to go see an expert fast. So if that's not a dermatologist, go see a primary care doctor. There's plastic surgeons. If you have a relationship with someone of that sort that you can get in faster, do so. And I say that because when you see an expert, they can tell you what the problem is a lot of times, or they can do the necessary diagnostic test that will help them to figure out what the problem is. And time will be on your side, because if you prolong the process of going to see an expert because you're doing things at home, or for whatever reason you think it's just going to go away, well, you're causing more and creating more anxiety for yourself. And that is another reason why people do get depressed or upset over their skin problems, is because they have no control over it. Well, in this case, by you getting in front of the situation, you will have more control. So number one, like I said, go see an expert so they can try to figure out what the problem is. And then if they prescribe something, use it. And I say that because for whatever reason, there's reasons why people don't use prescription medications. One, they couldn't get it for whatever reason. Then the primary doctor or whomever with the prescription need to know that. But two, you may decide you don't want to use it. And that's fine. And if that's the case, hopefully you're very good at what you're doing, and you have something at home that you can use, that you'd rather use. But you know what? You may want to make sure you run that by the expert that you went to see, so they can be on the same page or in agreement with, and can tell you if that's a good option or not. Okay. Again, number three, do not pick. Stop picking, whatever you used before. If it didn't work by the time you went to see the expert, then abort. And lastly, give it time. So as you're using this prescription product, or when whatever is prescribed or recommended, and it is working, give it time to clear the area using the prescription or the treatment as recommended, and giving it time to resolve your lesion. Okay. And I say that because a lot of times people think, acne. I had a student to see me, and the thought process was, well, the acne wasn't gone in a day, so he stopped everything. Well, some things take time. And if you need to know how long does it take, ask that question of your doctor or your expert person that you're talking to, and they can tell you what to look for. So if they say, oh, it should be gone in a week, or you should see some resolution in 2 days or a week, then after that time, if you're still breaking out and it's not getting better at all, then you have every right to go back or call and have concerns and state those concerns. So those are my suggestions for you. And again, you always want to get in front of it. Stop picking, see an expert, do what's recommended, and give it time. Any questions? Perfect. Thank you. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. And if you do have a situation where you cannot get into the doctor fast enough and you want to take care of the situation at that moment, by all means, go to yes.I.want.clearskin.com. Again, yes.I.want.clearskin.com. Take care.